Every technicality
DJ Sly.
where she give me eye test. Oh, boy, see sweetie, this one I face too fast. You must secure my best. If you run me and you be good best. Then I take you back home to my best. So me and you just go to bed. You must secure my best. If you run me and you be good best. Then I take you back home to my bed. Hey, you see this girl, you put a smile on my face. Now waiting when you do me, see me at the shake. I say I want you pass the national cake. I be you know, say that true, no be fake. I dey Jones like say I don't think. My personality, them say nice like yeah. Don't mind the time when you pass me at the stick. You go cure my if you run me and you be good then I take you back home to my best. So me and you just go to bed. You must secure my best. If you run
these DJs
then I take you back home to my bed. Hey, so you see this girl, I say your time is done. The spring baby say this your up or go finish. So the move where you they make my body to the move. Girl, I know waiting where you they do. You got me on a cruise on a very high pace. You they show yourself every time I'm blessed. The captain of my team, my player of the day. You go cure my grace. I must cure my grace. You must cure my grace.
Baby, you too bad like that. I can't let a beautiful princess just pass me by. I know without your love, there's got me hypnotized. Shit, I do use it. I feel a love at first sight. You don't really understand. What do you do this way? Girl, your love don't take control of me. Oh no, I don't wanna one night stand. Girl, I wanna be your man. Girl, I want you to have my kids. Cause you knock me up my feet. You make my heart go. Girl, you make me
these DJs bad.
Baby, if you be my lover, I will take you all around the globe.
DJ Sly.
My boy, I see you to but I shut the want to worry for it. This beauty comes along with style. You don't really understand. What do you do this man? Know your love is gonna hold on me.
We wait for the presence for the arrival of the coordinating minister. I beg your pardon to just have a little more patience. We will start in immediately. Every other guest that are meant to be here are already present, but we will await the arrival of the coordinating minister for us to start this program. Thank you.
Has found a good thing and obtains favor from the Lord. You found the harmony to the song you sing. You can do anything you wanna call. You are a father and a brother and a lover and a cover and a teacher and a everything. She's your mother, your sister, your lover, and your cover, and your teacher, and your everything. because paper go the right. Cook on radio the next story, paper the right. Cook on radio the next story. Your mama eye don't see, body don't tell me. Wait till me, I want to know. Oh, my eye don't see, body don't tell me. Wait till me, I want to know. Oh, no pain, no gain, no. If you try and fail today, make you no stop till they try again, again and again. Oh yeah, London fever. Make you no go the cheaper. Make you no one like pound, we no get sense. There's some man I am a winner. Tell it to the man we no get liver. Say bell mash for the fight from on hotel. But people we must stand and they don't feel jump first. Oh yeah, London fever. Make you no go the cheaper. Make you no one like pound, we no get sense. There's some man I am a winner. Tell it to the man we no get liver. Say bell mash for the fight from on hotel. But people we must stand and they don't feel jump first.
Number one, tribal, evergreen.
This DJ.
Check, watch me do my thing. Watch me now. I'm spitting more rhymes than every jack. I'm on EBs like that. Said I'm ahead of the game. Watch me do my thing. Watch me now. I'm spitting more rhymes than every jack. I'm on EBs like that. Check it. My time is now, it's a matter of fact. And I'm more serious than a head attack. You took my style and now I'm taking it back. And now you're feeling me, telling me, Kelly, let's distract this game. Now me be the masher. Me run corruption, cause me not pasha. And the lyrical style I got. Always rock the spots, making the body sit so hot. Like B Brown, I love the stage, yo. Like Shoki, you can say that I'm a ghetto soldier. I spit my mind for me and for all. And who's gonna like me? Because I'm ahead of the game. Watch me do my thing. Watch me. I'm spitting more rhymes than every jack. I'm on EBs like that. Said I'm ahead of the game. Watch me do my thing. I'm spitting more rhymes than every jack. I'm on EBs like that. Okay. What's mine is mine and can't nobody take it. I put my petty jar and can't nobody shake it. Now on the magazines, I'm on the front page with me tribunal fellows like an army brigade. So pave way, I mean, you don't know who we be. Now we wearing the whole of it in the street. I mean, I said the Babylon, me still I smoke the weed. Shout out to see. Yes indeed, black face me up, come with a brand new style. Let them down on hip hop, all the way then come on child. Yeah, better than the old and me got myself signed. To me, I'm gonna miss a style. Now I wanna be the champion. Take the pose in the competition. Give me the lemon, no sophomore. I wanna miss a clap on the hand. Now I wanna be the champion. None of them fit the pose in the competition. Give me the lemon, it goes 1 for the rhyme and 2 for the show. 3 to Ali as I collect my dough. Hey, I follow Simikuna shit body anytime.
Yes, we are all welcome to the Geneith Health Competition for secondary school students and students in the tertiary institution. We await the arrival of the coordinating minister for us to start. You're all welcome, and we hope to start once we see him so that we can start early. Thank you all for making this thing happen today. And today is our World Press Conference for this competition to start. And the registration will soon start by June 1. So you're all welcome once again to this World Press Conference. Thank you so much.
Wanna get it off my chest, take my time and reinvest. Asking, is it worth it? All the sleepless nights, the fights and the crisis, the critics biting. Mama told me there'll be days like this. Put your pen to paper, never use your fist. Imagine how I came through my fears rhyming. Started my career, blew it up with the tribesmen. A lot of people had their own opinions. Took it in my stride and stuck with my onions. They think they know who she would be, should be. Numb by the pressure, see I really wanna be me. Inspiration gone, direction gone. Packing my bags, I must be done. But my heart keeps drawing me back. You can do it, baby, one more track.
the changa, they no get online, and they go the shakara. They no get one kobo. When they go school, they go they do shakara. But when they get to, they go the drinking gari. We say drinking gari be no sugar at all. We say drinking gari be no pure water. Tell me why you know they eat turkey? Why we say every day na gari gari? Tell me why you know they eat chicken? Why we say every day na gari gari? You get one get them congozi. This girl likes to do shakara. If she come my house, she go demand for talk.
I get wings to fly. Oh, I'm alive.
You are now listening to DJ Jom of Create More Music, a Music Madness request zone.
When you call on me, when I hear you breathe, I get wings to fly. I feel that I'm alive. When you look at me, I can touch the sky. I know that I'm alive. When you bless the day, I just drift away. All my worries die. I'm glad that I'm alive. You've set my heart on fire, filled me with love, made me a woman on clouds above. I couldn't get much higher. My spirit takes flight, 'cause I am alive. Oh, when you call on me, when I hear you breathe, I get wings to fly. I feel that I'm alive. I am alive. When you reach for me, places deep inside, God knows that I'll be the one standing by through good and through trying times. And it's only begun. I can't wait for the rest of my life. When you call on me, when you call on me, when you reach for me, I get wings to fly. I feel that when you bless the day, you bless the day. I just drift away. All my worries gone. I know that I'm alive. I get wings to fly. God knows that I'm I pray you'll be alright and watch us where we
Again, welcome to the World Press Conference of the Geneith Health Competition for secondary school and tertiary institution students. While we wait for the coordinating minister, who is already on his way, I want to recognize the presence of the directors of the Geneith company. We have Dr. Godwin Umenwa. He's here. A round of applause to him. Let's appreciate him. We also have another director of Geneith that is here, the engineer, Omai Bello. A round of applause to him too. He's here. You can come in front and have your seat. We have some distinguished directors that are here with us, and we'll be recognizing them as we go forward. Yes, a round of applause as they come in. Thank you. We also want to recognize the presence of Professor T.J. Bande. He's here. He is the former United Nations General Assembly President, also the former Director General of NISS, and former Vice Chancellor of Usman Danfodio University, Sokoto, and currently the Bande of Besse in Kebbi State. A round of applause to him. He's here present. While we wait, let's have a little documentary before we continue. Thank you. Media.
In the heart of Nigeria, a silent battle rages, a battle against a disease that has claimed countless lives and stunted the hopes of millions. Malaria, a preventable and treatable illness, remains one of the leading public health challenges in our nation. Every year, malaria claims the lives of hundreds of thousands of people, yet paradoxically, it is one of the most preventable diseases on earth. In the shadows of under-resourced and rural areas where healthcare access is limited, this silent killer continues to thrive. Malaria caused by Plasmodium parasite and transmitted through the bites of the female Anopheles mosquito flourishes in tropical climates where stagnant water provides a perfect breeding ground. According to the World Health Organization, the WHO, over 240 million cases of malaria are reported annually, with more than 600,000 deaths. Alarmingly, Nigeria accounts for 27% of global malaria cases and 32% of global malaria deaths. This translates to a staggering 22 people dying every hour due to malaria in our country. A 2022 WHO report indicates that over 66 million malaria cases occur each year in Nigeria, affecting more than 90% of the population, with children bearing the brunt of this devastation, as highlighted in the 2018 National Demographic and Health Survey, NDHS. The consequences of malaria extend far beyond health. It represents a socio-economic challenge that drains families of resources and perpetuates circles of poverty. Yet, amidst these grim realities, there is hope. We possess the tools, knowledge, and resources necessary to combat this disease effectively. This is where the Geneith Health Competition comes in. Organized by CEO Africa, this initiative aspires to empower the next generation of leaders by providing a platform for secondary schools and tertiary institution students to explore, innovate, and advocate for malaria prevention and control. By channeling their energy and ideas, we can tackle this preventable disease head-on. Through the Geneith Health Competition, students will engage in health education, advocacy, and community participation. Armed with knowledge, they will devise creative solutions tailored to their local challenges, solutions that resonates across Nigeria. The urgency of this initiative could not be more pronounced. Coinciding with World Malaria Day, we send a powerful message. The time to act is now. To eliminate malaria in Nigeria, we must embark on a concerted effort involving all stakeholders, ensuring that public awareness reaches even the most remote corners of our nation. It is essential to recognize the innovative approach taken by CEO Africa in powering the Geneith Health Competition. Special appreciation is also due to Geneith Pharmaceutical Limited for sponsoring this competition, with Qatar Soft Gel for sponsoring and powering this project with over 1 billion naira in cash and gift items, which is the first of its kind in Nigeria. We'd like to thank our sponsor under the leadership of CEO Chief Emmanuel Mura. We cherish your support. With the Geneith Health competition, we are confident that the message of awareness will penetrate every nook and cranny of our communities. The youths, who are the driving force of our country, will emerge as champions in the fight against malaria, advocating for change and mobilizing their peers. As Albert Einstein wisely stated, life is like a riding bicycle. To keep your balance, you must keep moving. Eliminating malaria in Nigeria requires a collective effort. Let us join this initiative to better achieve our shared goal of a healthier future. This program is sponsored by Geneith Pharmaceutical Limited and powered by Kotala Force Softgel.
Thank you for that documentary, CEO, and also a big thank you to the sponsors of this program. We're going to start with the opening prayer, national anthem. Okay, let's welcome the MD of Geneith to take his seat on the stage. Let's make welcome Chief Emmanuel Omenwa, CEO Geneith, as he takes his seat on stage in preparation of the World Press Conference for the Geneith Health Competition.
Mr. Emmanuel.
Thank you, sir. Okay, Mr. Emmanuel Omenwa. Thank you. We also want to recognize the presence of our own chairman, Fam Hajia Mosilat Giwa. She is the chairperson, governing council of the Pharmacy Council of Nigeria. A round of applause as she also takes the stage. She's the chairman of this occasion. With her is our own Professor Cyril Odianuse Usifo. He is the immediate past president of the Pharmaceutical Society of Nigeria, and today he is the chairperson of the assessors for the Geneith Health Competition today. A round of applause as he takes the stage. I don't know if the coordinating minister is here present already. Okay, thank you. Okay, we also want to recognize the presence of Professor Mohamed Ali Pate. He is the Honorable Minister of Health and Social Welfare. He's a special guest of honor, and today he is being represented by Dr. Godwin, the Director of Public Health of the state. Welcome, a round of applause as he also takes the stage. Okay, thank you. Okay, here present also, let's also recognize the presence of Professor Catherine Nonyalom Stanley. She is the National Chairman of Nigerian Association of Pharmacists in Academia, NAPA. Professor Stanley is also a professor of pharmaceutical microbiology and biotechnology at the University of Port Harcourt. A round of applause, ma'am. We also recognize the presence of Pharmacist Agwaye Isaiah Ogenero, Chairman, Caretaker Committee, FCT of ACPN. He's here present. A round of applause to him. Okay, while I was making the announcement, I noticed the arrival of the president of Pharmaceutical Society of Nigeria, Pharmacist Ayuba Tanko Ibrahim. A round of applause as he takes on to the stage. Welcome, sir. My president. Recognize your presence and we also want you to take the stage as we start this conference. I also have in my list Professor Ahmed Allah. He is the Honorary Commissioner, Ministry of Basic Education, Sokoto State. He's here present. A round of applause to him. We also have Tajuddin Olutope. She's the National President, Institute of Dietetics in Nigeria. She's here present. Where is she? Okay, thank you. Round of applause. I'm sorry. I thought it was a she because it was not recognized. Sorry. I was trying to get the protocols right. We also have Dr. Farouk Abubakar Umar, the Honorary Commissioner, Ministry of Health, Sokoto State. A round of applause. I have here Navy Captain A.O. Oyeniyin. Okay? He's Assistant Director, Clinical Services, Training and Research, Naval Headquarters, Abuja. A round of applause. I also have Mrs. Rose Lakwap. She's the Director of Science and Technology, and she's representing Dr. Mrs. Kachalu Gang, Honorary Commissioner, Ministry of Education, Plateau State, Jos. A round of applause. I also have here Pharmacist Emeka Duro. He's the past National Secretary of Pharmaceutical Society of Nigeria, and he's here representing Pharmacist Uche Apakama, the Chairman, Board of Fellows of Pharmaceutical Society of Nigeria. A round of applause to you, sir. And I have Pharmacist Uzoma Nwigudu. He is representing the Pharmacist Ambrose Eze, the ACPN National Chairman. Is he here? A round of applause to him. Ambassador Eguyobi Samuel. Am I right? Sorry if I don't get it correctly. I'm really sorry. I'm seeing for the first time. And he is the NANSET President and Chairman, Council of Presidents. A round of applause to him. I'm sorry if I get your name wrong. And we have Christiana Danielle Shorunke, State Coordinator, Lafia, Nasarawa State, Ministry of Health, Lafia. A round of applause. Okay, I think I recognize that. Okay. Please, as we go forward, we keep having some recognitions, but I beg your pardon, we should stop, we should continue, and let's start. Okay, I have here Dr. Augustina Godwin. She's the Commissioner for Education, Taraba State. A round of applause, sir, ma. Thank you. Thank you all, and welcome to the Geneith Health Competition for secondary school students and tertiary institution. We are starting now with an opening prayer. Opening prayer. Okay, the chairman said that Professor Cyril Yanusil Sifo will take us with the opening prayer.
Father, we ask for your grace to be able to do what you want us to do today. In Jesus' name we pray.
Yes, that was a beautiful prayer by the immediate past president of Pharmaceutical Society of Nigeria. Thank you. Let's rise for the national anthem.
Nigeria, we hail thee, our own dear native land. Though tribe and tongue may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace all battle honored, and this we count as gain. To hand unto our children a banner without stain. O God of all creation, grant this our one request. Help us to build our nation where no man is oppressed, and so with peace and plenty Nigeria may be blessed.
Thank you so much. Thank you. Round of applause as we take our seats. Okay, we've been having some introductions already, so now I want to invite the MD team lead, CEO Africa, for the welcome and opening remarks. A round of applause for Cletus.
The Honorable Minister, Chairman of this occasion, and eminent personalities on the high table. I recognize everyone here. Without wasting much of our time, I'll go straight to the address. It is a true pleasure to see a wonderful opportunity for us to make history in our country, Nigeria. This Geneith health competition is primarily to eradicate malaria in Nigeria, and of course help the institution mandated to eradicate malaria. It is a well thought out program to catch them young, focusing on secondary schools and indeed tertiary institutions, for us and for them to be ambassadors of war against malaria. This historical project is what is well thought out for these people to own it, to know that malaria is a collective effort for us to fight. And today, this competition, we want to specially thank the MD of Geneith Pharmaceuticals for accepting to sponsor this competition, giving away over over 1 billion for this great event. The people at the secondary school and of course tertiary institution will be winning over 400 million, and indeed over 600 million in gifts for this competition. It's one of its kind in Africa, towards making them to own fighting malaria through quiz on malaria and health. Please, we want to urge eminent Nigerians to follow suit on what Geneith is doing through Quota that is powering this project. We're very happy to welcome you all. Thank you and God bless you.
Okay, thank you, the CEO, team lead, for that welcome address. Now we make welcome the chairperson, Geneith Pharmaceutical Limited, for a press speech. Let's invite Mr. Emmanuel Umenwa with a round of applause. I got it right. No, you can sit there for the camera. I'll bring this mic to you. It's press briefing.
Okay, it's better. Yeah. Okay, it's okay. There's a lot of comfort for me. First of all, I want to apologize for starting this occasion some few minutes or about 30 minutes behind schedule. I hope you will bear with us. Good afternoon, ladies and gentlemen. The gentlemen of the press, our distinguished guests, esteemed advocates of public health, the members of the high table, starting with our dear chairman, ladies and gentlemen, please permit me to stand on the existing protocol. It is for me an honor indeed and a rare privilege to address you today at this critical point in our ongoing campaign against malaria. As the CEO of Geneith Pharmaceuticals, I am thrilled to unveil an initiative that not only underscores our commitment to public health, but also seeks to catalyze meaningful change among our youth through strategic corporate social responsibility. Called the Geneith Health Competition, powered by Qatar Subgel. To say that malaria is Nigeria's #1 health challenge is indeed to restate the obvious. And this is given that Nigeria, according to World Health Organization, WHO, reports showed us that accounts for 27% of global malaria cases. You all can agree with me, and 31% of malaria deaths. In 2022 alone, for instance, Nigeria experienced 66.7 million malaria cases, resulting in about 189,321 deaths, with the majority occurring in children under the age of 5 years. Also in the following year, 2023, malaria incident in Nigeria was 299 for every 1,000 persons. Of course, these figures are scary and sufficient enough to warrant declaring the battle against malaria a national emergency. And this is exactly what we are set out to do. We are gathered today under the theme, let's come together to reinvest, to reimagine, to reignite, and stay committed. This year's malaria their team encapsulates our unified mission and serves as a guiding principle for our collective efforts in combating malaria. We must reinvest in our public health infrastructure, if only to effectively confront a disease that claims lives every minute. This will involve ensuring that necessary resources, financial, human, and technological advancements that are strategically allocated to combat this preventable illness. It will also require investing in community health programs, enhancing access to medical care, and ensuring that sufficient funding is directed towards malaria prevention and treatment initiatives. But that's not all. The battle against malaria also demands reimagining. It is important that we reimagine our approach to this challenge by embracing innovation and creativity, especially in how we address it. Our aim, therefore, is to use the Geneith Health competition to encourage young minds to think outside the box with a view to developing new ideas, concepts, strategies for malaria prevention. This will involve leveraging technology through the social media and community engagement to raise awareness and drive positive change. Our target is also to reignite our passion for the battle against malaria. This will involve rejuvenating our collective commitment to the cause, especially among our youths, who are not only the leaders of tomorrow, but also the change makers of today. We do this by motivating them to take action. We'll be empowering them to become champions of public health, who will assist to spread the message of prevention and awareness in their communities. Having taken the above actions, we will also ensure that we stay committed to battle against malaria, if only to see that it is completely defeated, by reinforcing our dedication through continuous collaboration and advocacy. We will ensure that we maintain momentum in the battle until we achieve a malaria-free Nigeria. We do this not to see through the Geneith Health competition as just a mere event. It's not just a mere event. It is a movement. And it's a platform designed deliberately to engage students, especially those in tertiary institutions, in innovating problem solving and advocacy around malaria prevention by channeling their creativity and energy. We seek to empower them to take ownership of this fight, thus becoming champions of health in their various communities. Through this competition, participants will engage in public health advocacy, project designs, community outreach programs. These are efforts aimed at fostering a culture of health awareness and advocacy that is deeply rooted in the unique needs of local communities. With a prize pool exceeding over 120 million, this initiative reflects our unwavering belief in the potential of our youths to effect change. We understand that malaria disproportionately impacts vulnerable populations, particularly children under 5 and pregnant women. Our goal through this competition is to inspire a new generation of healthcare champions who will truly grasp the importance of prevention and effective communication. This initiative also aligns with the strategic objective of the World Health Organization, WHO, and Nigeria's National Rollback Malaria Program. The partnership amplifies our efforts, ensuring that we are reinforcing global and national goals in combating malaria menace. Ladies and gentlemen, as we embark on this significant journey, I urge all stakeholders, honorable ministers of health and education, state commissioners, development partners, policymakers at various levels, educators, civil society leaders, members of the press, etc., to join us in this fight. Your support, influence, and expertise will be required as we strive to extend our reach into all the nooks and crannies of Nigeria. Let us join hands and ignite the sparks of hope and innovation. Together, we can inspire our young leaders to dream, act, and ultimately guide us towards a malaria-free future. As we move forward, let us commit ourselves to this thematic framework to reinvest our resources and efforts into effective healthcare solutions. Reimagine how we approach malaria prevention, reignite our passion for public health advocacy, and stay committed to our goal of totally eradicating malaria in Nigeria. This is not just about a competition. It is about creating a culture of engagement and awareness among our youth, empowering them to understand the critical role they play in the battle against malaria, and inspiring them to take decisive action within their respective communities. We presently stand at the crossroads. You all can agree with us. Our actions today will shape the public health landscape of tomorrow. With every project designed, every campaign launched, and every community reached, we are inching closer to a future where malaria is no longer a formidable foe, but a chapter in our history that we have successfully closed. I therefore invite you to embark on this journey with us, which promises not just solutions, but a brighter and healthier future for both our children and fatherland. Together, we have the power to make a lasting impact. Ladies and gentlemen, let's seize this opportunity. Thank you very much, and thank you for your patience. Thank you for listening, and may God bless you all. Thank you.
A round of applause to the CEO, Geneith School Limited, for that wonderful press briefing. Thank you so much. Next, we're going to take some remarks, but before we take that, I also want to recognize the presence of Professor Ruth Adio Moses. She is from the University of Ibadan. the PRO, School of Health Education and Professional Association in Nigeria. I also want to make mention that she is also one of the assessors for this Geneith Health competition. A round of applause to her. Here present is also pharmacist Salamatu, which I know that she is the PSN chairman of FCT. Here present. You're welcome, ma. A round of applause to her too. Also representing pharmacist Norma Scholastica Ilan. Okay, she is also representing pharmacist Scholastica Ilan, the national chairman of Association of Lady Pharmacists. A round of applause, ma. Thank you so much. Okay, on the next, we're supposed to take remarks. My chairman, are you ready? Chairman, are you ready? Okay, we're meant to take your remarks. I don't know if the online person is ready. No, not for you yet, Fred, but I want you to be aware that we want to take something from online, not present here. Okay, not yet.
Okay, ladies and gentlemen, it is very important that what we're doing today is a holistic thing. We have the student bodies here, the president of National Association of Nigerian University Students, president of National Association of Nigerian Polytechnic Students, president of National Association of Nigerian Colleges of Education Students. They are all here. May I have you rise so that they would all... The reason of bringing them here is because what we're doing is student-focused, centered project. If we must achieve eradicating malaria in this country, these are the people that will drive it. And that is why they are actually the drivers. Thank you very much for your time.
Thank you. Are we having the online now? Okay, later. So we are going to invite, let's invite Professor Cyril Odiano-Sifo. He is the immediate past president of the School Society of Nigeria and also the co-chairman, College of Assessors for this Geneith Health competition. I want to invite him for his remarks before we can proceed.
The chairman, Pharmacy Council of Nigeria, the CEO and the Oga Patapata of Geneith Pharmaceuticals. It's not, is it? Okay. Yeah. My chairman has regulated me. She said I should sit down. For you to have taken the bold step to address this public health problem, we say kudos to you. Particularly when Nigeria accounts for over 25% of malaria cases in the world. And indeed, I know one of my PhD students worked on the pharmacoeconomics of anti-malarials. And one of the things they came up with, Professor Waka, was the fact that when somebody has a malaria issue, it affects the workforce, it affects the family, and it affects everybody indeed. So I think taking the opportunity to invest and reignite this issue is quite welcoming. And making sure that this opportunity is being propagated by students, particularly in the higher institution, is also remarkable. Because when they are more enlightened and they know these things, they will be able to drive what we need to do to bring down this menace in the society. I will tell you this, and I will end with this. When I wanted to start my PhD program, sometime in 86, 87 in Germany, I wanted to get involved in the malaria vaccine program. But whether you like it or not, I was not allowed to, because malaria wasn't their problem. And so we believe that other people, other stakeholders will emulate your effort and then work with you, and we can together bring the cause of malaria, the burden of malaria down in this country. Being the most populous black country, I believe we should be able to bring it down so that our workforce can benefit. Once again, I say kudos to you, and we hope that this program will go a long way. Thank you very much.
Okay, thank you, Professor Cyril Diano Sifo. He is the chairman, co-chairman of the assessors for this program. My president, I want to call my president. I call him my president because he's my president. I don't know if he's your president, but it's me. I personalize that. Yes, Pharmacist Ayuba Tanko Ibrahim, we want him to make a remark before we call on the United Nations representative here. Thank you, my president.
The chairman of today's occasion, MD CEO of Geneith Pharmaceuticals, my immediate past president, my immediate ancestor, Honorable Minister, Commissioners, and all special guests present, my colleagues, ladies and gentlemen. I feel very happy to be part of this program today. CEO Cletus called me last week on phone and was telling me about the program. I checked my itinerary. I told him it is not possible because I had a series of workshops, meetings, conferences to attend. He just pleaded. I said, okay, if I see a window for me to attend, I will. I just came out of a residential workshop on preparing a policy on e-pharmacy just yesterday. And I was supposed to be in Lagos tomorrow. So whether I'm in prayer or whatever it is, so today I happen to be free. So I decided to come. So I'm happy to be here. I commend Geneith Pharmaceuticals for organizing this event. Like you said in your speech, MD, this is part of your corporate social responsibility. And we wish every pharmaceutical company in Nigeria, and indeed every member of any industry, will set aside some funds for corporate social responsibility the way you are doing. We commend your effort, and may God help you. For my colleagues, I try as much as possible to attend this kind of events as a form of encouragement for our professional colleagues in the industry to give their best. Most of our fights is for them to have an enabling environment to carry out their activities so that we will have what we call drug security in Nigeria, because the more we manufacture drugs in Nigeria, the more the drugs are available and the cheaper they become. So, sir, whatever we do to encourage you to be able to enhance your manufacturing activities, let us know so that we can reach out to the government, do advocacy, and get it done. Thank you very much. I wish everybody a good day in this program, and may the best team win.
Thank you, my president. Okay, my chairman just stepped out. Please, let's also make welcome to the high table. I think I recognized him here before, but I don't like looking at him at that audience. He's meant to be somewhere here. I'm talking about Professor T.J. Bender. He is the former United Nations General Assembly President and also the former DG NISS, former Vice Chancellor of Usman Danfodio University, Sokoto, and currently the Bender of Besse in Kebbi State. A round of applause as he takes his rightful seat. Sir, you are going to sit there. I'm sorry, sir. Yes, my chairman is here. My chairman, your remark.
You are welcome. I recognize the CEO, Geneith, my president, Pharmaceutical Research of Nigeria, past president, and Your Excellency, you are recognized, and our representative of the Honorable Minister of Health. Distinguished guests, and our students, and the Geneith staff, gentlemen of the press. Technology. Yes. On this occasion of the World Press Conference for the launch of Geneith Health Competition, it is indeed an honor for me to stand or to sit down before you today at this pivotal moment in Nigerians' health advocacy journey. I salute this bold, commendable initiative by CEO Africa in strategic partnership with Geneith Health for the loud voice and campaign against malaria as part of the 2025 World Malaria Day commemoration. I don't need to dish out any further data, but we all know that malaria is a burden. It remains a very serious threat to our global health, and sadly, we carry more burden in the sub-Saharan Africa, and particularly in Nigeria. Most of the deaths, globally, occur, in the sub-Saharan Africa, up to 95 to 97% of the global malaria deaths. Nigeria, alongside the Democratic Republic of Congo and Niger, I've said earlier, accounted for over half of the figure quoted. One key factor often overlooked in the spread of malaria is the human movement, especially in high-density areas where people are constantly on the move. This makes us all vulnerable, and it's a good reminder that malaria is not their problem. Professor Jss just said it now. It is our problem. So this is why this initiative is just very timely. It's powerful, this initiative, because it is a call for action. Some of the persistent challenges we face in malaria control, we all know, include poverty, which limits access to prevention and treatment. Also inadequate and unsustained funding. We also have resistance to insecticide-treated nets, particularly in sub-Saharan Africa, where mosquitoes are evolving faster than our interventions. But we are not helpless. Promising new interventions have emerged, including the next generation insecticide-treated nets, and also the introduction of malaria vaccines. The community-driven awareness programs like this one that is about to be launched today, is very important in the new interventions available to us. And please note, prevention remains the best intervention method. Now let's talk about why we are really here today. The launch of the Geneith Earth competition, the bold initiative by Geneith on youth. Yeah, let me digress a little bit. I was just discussing with the CEO. When you want to achieve progress in any intervention, target the young people. When they know, wherever they go, they say it. They go to their parents, they talk about it. To their peers, their friends, they talk about it. So this is just the right target group we are launching the campaign for today. This isn't just a campaign, it's a movement. To me, it is a movement. It's one designed to roll back malaria through education, advocacy, and active engagement. It's national in scale. The way, you know, because I read a little bit about what you're about to do. It is very strategic in the planning you are doing. And the bold execution will do a good job for us. It is powered by two forward-thinking institutions, CEO Africa and Geneith Pharmaceuticals, whose vision for malaria-free Nigeria is being translated into real action today. I'm proud to be part of this journey, and even more proud to witness the official unveiling of the Geneith Earth project and the launch of Geneith Earth competition with over 120 million worth of prizes across 3 major students categories. Junior secondary schools are involved, senior secondary schools are involved, and the tertiary health institutions are involved. This is more than a quiz. It is an empowerment platform, a tool for awareness, and a spark of sustainable change. In conclusion, let me say this. You have targeted the right population, as I said earlier. One, the population that is energetic, intelligent, and fully capable of driving this movement to a success. Am I correct? I'm indeed proud to be part of this, and I would be grateful if I can, you know, I can follow through the processes, because I've engaged in youth programs and the progress of, you know, my career. So I'm indeed proud, and I believe that together we shall succeed. Thank you very much.
A round of applause to my chairman. Thank you so much. What I will promise you is that you are going to follow us through this program, because it's going to be highly publicized and it has national content. Thank you. So now we're going to call on the coordinating minister, Professor Mohammed Alipate, that is being represented here by Dr. Godwin, the Director of Health, for his own remarks before we can unveil why we are here. Thank you, sir.
Thank you very much, Mrs. Moderator. My name is actually Godwin Tadom. I don't bear a single name. It's still double. I need to acknowledge the chairman, the president, and all the members of the I-table, as well as people sitting on ground on the opposite direction. Please permit me to sit to continue. Well, malaria is one of the oldest diseases documented, several centuries, millennium, I would say. Not until 1880, when one French, Charles Laveran, Alphonse Laveran, saw a parasite in the blood of a 24-year-old soldier. He saw it but didn't understand it. 17 years later, in 1897, another man came up. That's Sir Ronald Ross. And there I was able to learn that it's possible that mosquito bite was responsible for malaria, but I didn't know beyond that. Then another scientist, a physician, Patrick Manson, eventually linked the two. That is the bite of mosquito leading to the disease. By the year 1900, it was published in British Medical Journal that what was actually responsible for malaria was the bite of a female Anopheles mosquito. And at that point, the knowledge was clear, and every country went to action. By 1912, Belgium pushed malaria to a point where it was no longer a public health disease. By 1922, Britain was able to push it down to a point that it was no longer a public health issue. America lasted to 1947. By 1964, almost all the European countries have been able to eliminate malaria. And coming down to Africa, unfortunately, no African country achieved this. Nigeria hosted the biggest meeting on malaria in the year 2000, which led to the rollback malaria meeting in Abuja here, and where there was Abuja Declaration. 25 years gone, Nigeria is still having malaria. We were lucky in the past few years, about 4 African countries have been able to achieve elimination. Algeria has been able to eliminate malaria, and Cabo Verde of recent, we had also has eliminated malaria. Nigeria hosted the rollback malaria, and just last year, the coordinating minister hosted another big meeting that brought almost the entire world in the medical field to Abuja, and that was rethinking malaria in Nigeria. All these are the efforts. Where are we as a country? We indeed probably have not done enough. And one of the 9-point agenda the coordinating minister mentioned was the community involvement. And it rings very clear in this particular meeting, involving children. We should also know that malaria is not just an health issue. We look at it from the point of our failure, that is the sickness. But it's infrastructural problem, it's environmental problem, and the consequences could be emotional, could be economic, and several others. These are the things we've been battling. And I must commend you that the efforts of your organization, Geneith Pharmaceutical, is great and is laudable. And I think it is driving one of the points of the coordinating minister home. On this, thanking the chairman for inviting the coordinating minister, who unfortunately is unable to be here this morning because he traveled out. And he has asked me to represent him and also to congratulate you and bring his facilitation to this program. On this, I want to declare and launch the Geneith Health Competition Open. Thank you very much.
Thank you, Dr. Godwin Tandong. You say your name is not 1, and I think I've tried in getting it 2 now. So I think I need a round of applause for myself too. Thank you so much. Okay, we had an apology here. The Dr. Professor Bala Muhammad Awudu. He is the president, Nigerian Medical Association. He's also a co-chairman, the College of Assessors, sent in an apology for his absence because they're having an AGM presently at Castina. So he just sent that apology. And is she online yet? I think we'll have a guest online that wants to talk briefly before we unveil. And are they ready? Are they ready? Online. Okay. Let's welcome Professor. Let's also recognize Professor Chinedu Peace Babalola, the former Vice Chancellor, Chrisland University. She's also a member of the College of Assessors. She's online and want to address us now. Media.
Okay. Good afternoon.
Okay, hold on. Okay, so hold on. We're holding on.
I really count it a privilege and honor to be invited to be part of this maiden edition of the Geneith CEO Africa Essay. I apologize for being unable to be at Abuja with you today because of conflicting programs. And I'm really excited at what I've heard and what I've seen, and excited about this year's theme, Malaria Ends With Us. We invest, we imagine, and reignite. I really applaud the government presence, the CEO of Geneith, CEO Africa, participants, and so on. This theme really calls for sustained action. And I want to say that we cannot belabor the topic of malaria because many of us are sufferers. I suffered it a lot. It almost cost me my admission to Federal Government College in Enugu. Most of my research has been on malaria since my master's days till date. Even my PhD was on pharmacokinetics of quinine at that time. And we are still battling with it. So the objective of the competition on this platform provides an opportunity for our young minds to explore and express their ideas on malaria. I know most of them have also suffered it. So we encourage them to really think creatively, and we adults to gain from whatever they will provide, so that it will contribute to global conversation, national and global conversation on elimination of malaria. I really want to again and again applaud the company and CEO Africa and all those stakeholders present and absent. I wish all participants the best of luck and in this competition. May your essays inspire, educate, and ignite passion for malaria elimination. Let us all work together to make a difference and create a future where malaria is a thing of the past. Thank you very much, and God bless.
Thank you. Round of applause to Professor Peace Babalola. Please, before we call on Professor Ruth, I want to call on the they called him the president of the presidents. Okay, so we're here because this program is an academic program and it's going to involve students, secondary school, tertiary institutions. So we're going to call on Comrade Egunjobi Samuel. He is the president of the National Association of Students, Nigerian University Students in Nigeria. A round of applause, just brief, before we call on Professor Rhodes, one of the assessors, to give a remark. Comrade Samuel, is that you? Okay, thank you. Brief.
Good afternoon, sir. Good afternoon, sir. Our fathers and mothers on seat, the commissioners for education, to Taraba State Governor, the mother of Nigerian students in Taraba State, We recognize you, ma. The founder, the co-founder of this great company, the chairman, all other dignitaries here present are recognized. So I recognize my co-students that are present here this morning. By the virtue of introduction, I'm not Egun Jobi, I'm Egun Jobi. So my name is Ambassador Comrade Egun Jobi Samuel Oluwaseun, and I'm a student of Osun State College of Education, Ilarango. And I happens to be the national president for National Association of Nigerian Colleges of Education Students, NASES. And at the same time, I'm also the chairman of the president of Colleges of Education, Universities, and the Polytechnic in Nigeria. So these are my co-presidents beside me. So this is Comrade Oyewumi Festus. He is the president of 4 Polytechnic students in this country. He is from Oyo State. And he, standing beside my right hand, is Comrade Peter Ojo, the president of all university students. And he is from University Bauchi State. Without wasting time, I would like to firstly commend the effort of these two companies that are collaborating together to bring this initiative: the Genetic Earth competition, the Genetic Earth Company, and the CEO Africa. They have done a great job, and I can tell you that because we cannot put everything on the neck of the government. We also, as an individual, the little that we can contribute to the community, we should do it. So on this note, we are appreciating the entire Nigerian students, are appreciating the initiators of this great initiative. We have spoken before now, we have given them our words. We are assuring you that the over 40 million students in Nigeria, we are their representatives. We are solidly behind you on this to pursue this great initiative, and I can tell you that we will reach the promised land by the special grace of God. Because another says earth is wet, and malaria. Some people make a mistake most time that it's just a malaria. If you have experienced this, you will know what it means. That it's not just a malaria. It takes lives. It takes lives. So, by the grace of God, we promise you that we are on this together. Thank you very much. And also, we are passing a vote of confidence on the CEO Africa. They are doing a great job. Aluta continua.
Yes, Aluta continua, Victoria Asata. Thank you, the president of the presidents. We want to also recognize the presence of Nkoyo Oga. I don't know if it's a she or a he, but then this person is the National Malaria Eradication Program Coordinator. She's here present. Round of applause. Okay, briefly, let us have Professor Ruth Moses. She is one of the assessors. She said just 1 minute before we call on the Board of Fellow Chairman representative for a brief talk too. Thank you. Please brief. I need to unveil.
I stand on all the existing protocols and I say good morning to everybody. Mine is just a very short one. I thought it would be very important to talk about the benefits of this competition. This competition, just like the chairman and the CEO of Geneith Health mentioned in their speeches, will educate young people, will dispel myths concerning malaria, encourage preventive behavior. I'm like summarizing it. Encourage preventive behavior, empower young people, inspire young people to develop positive, innovative approaches, just like the chairman said earlier, support research and development, because it will go beyond just the competition. Students will want to go into research in that area. It will help in building community engagement, just like the chairman said, and peer-to-peer education in their discussion, they sit down, they want to discuss these things and even create other type of competitions within themselves. It will also help to develop skills in critical thinking, because we'll be asking them questions, critical questions and problem-solving skills, then communication and teamwork. So, finally, by hosting a competition on malaria disease for young people, Geneith Pharmaceutical is empowering them to become agents of change in their communities, promoting malaria prevention and control. I want to wish all competitors the very best, and I also want to say a very big thank you, sir, for organizing this competition. Thank you.
Thank you, Professor Roots. That was brave. You see, critical thinking, teamwork, and peer-to-peer education. Okay, please, we want to also, someone wants to invite someone to give a brief remark. He wants Tajuddin Olutope, the National President, Institute of Dietetics in Nigeria. Present. Okay, thank you. Please brief. Thank you. Yes, 1 minute.
Good afternoon, all. I want to stand on the 16 protocols as laid down by the MC. And I want to use this opportunity to salute the efforts of the initiators of this program. It is quite laudable and salutary. We are proud of the companies, especially the CEO, who has decided to earmark such a very massive fund towards this program. For us, we will be ready to collaborate and support this program as much as possible. So we thank every one of you for making it to this press conference, and we thank the organizers. Thank you very much.
Thank you so much. That was very brief. Okay, let's also welcome the chairman board of ELO, Pharmacist Uche Apakama, that is presented by Mr. Pharmacist Emeka Duru, for a brief recognition before we call on Augustina Godwin. Just hold brief.
Good morning, everybody. Let me stand on all existing protocols. I know my president, Pearson, is here, chairman, Pharmacy Council is here, and the immediate past president for Society of Nigeria. My name is Pharmacist Duru Emeka Kalistus, former National Secretary for Society of Nigeria. I'm here to represent the Chairman Board of Fellows, Pharmacist Uche Apakama. And let me start by commending and thanking the Co-Africa and Geneith Pharmaceuticals. The war against malaria is a war that must be won. I know that Geneith Pharmaceuticals has done a lot in the area of prevention, treatment, and this gathering is a sign that they want to now direct their effort towards eradication, because I know that for you to do anything creative, the youth must be involved, and this time our students from secondary schools and universities. I want to thank Jenny too, because I know that malaria is our common enemy, and I believe that with this kind of platform, the right energy will be directed towards the area we have not done so much on, and that is the area of eradication. I want to thank you once again, and I wish you success.
Thank you. Yes, because we are having an academic competition, so I want to briefly call on Dr. Augustina Godwin. She is the Commissioner for Education from Taraba State. After her, we also have Dr. Farouk Abubakar Umar from the Honor Commissioner, Minister of Health, Sokoto. So just get ready. She's not wearing the shirt, she's putting it on. That's okay. Thank you so much, ma'am. 1 minute.
All esteemed guests here present, especially those at the high table, all esteemed guests seated here as participants, ladies and gentlemen, members of the press, good morning. I am highly delighted to be here. I had to take the long journey to come all the way from Jalingo because anything that has to do with students, I personally am very passionate. As the Commissioner for Education and as a teacher by profession, I'm a mother to all the students. And so malaria is a disturbance to my own children. And when I saw about this Geneith health competition, and particularly there was one of you here that kept in touch with me to encourage me to come. I'm very happy for that encouragement, and I want to sincerely congratulate Geneith company for bringing up this initiative. Our children are as intelligent, as talented as other children all over the world. And I believe that this competition is going to stimulate a lot of brainstorming, a lot of cognitive interaction for the children. A lot is going to come up on the table for our children. So I am looking at it with keen interest to see how my own students, both at the basic section and at the tertiary, we are going to collaborate with the Commissioner for Tertiary to ensure that as this goes on, our children will key into it and that we give them the best support they need to be able to participate. So I congratulate you, and I hope that this will be the beginning of a greater future in terms of the health of our children as it affects, as it pertains malaria for us. So thank you so much, and thank you for bringing us. God bless us all.
Thank you, Dr. Agostina. Thank you so much. Okay, Dr. Abubakar Umar here. Good. Please, Dr. Farouk Abubakar. Okay, thanks. He is the Minister, Commissioner, Minister of Health, Sokoto State. As she comes, I'm going to, while waiting, the last but not the least, I think we're going to conclude with Pharmacist Salamatu Orakwelu. He is representing the national chairman, and you know, our children are going to be involved. So let's just bring mothers to seal this competition. Thank you.
Let me stand on the newly established protocol because of time. I want to commend the Jss Health competition because the Jss pharmacists coming into this public health challenge and choosing malaria in our society is a great encouragement, because looking at or living malaria fight to only public sector or to government is not achievable. If we have private sector of Jss to join hand with the government, I want to believe we can win the issue of malaria in this country. So I want to commend most sincerely the Geneith Pharmaceutical Company for this initiative. And I want to believe these competitions will take back the major problems that are preventable in our primary, in our secondary and tertiary level, improving environmental, especially in the dormitories and hostels. This is where the major problems have been. A lot of measures, a lot of policies were put in place by various governments, but with this private initiative, I believe will contribute immensely to achieve and resolve the issue and reduce the menace of malaria in our society. Thank you very much.
Thank you so much for that brief remark. Please, I also want to reinstate that everybody here is an important person and everybody wants to talk. And in as much as I want to say something that is in favor to what we're doing, we have to unveil this for us to get started. But then I've already mentioned Pharmacist Salamatu Orakwelu to come in and give her remark. And also the Commissioner for Education, Sokoto State, has been pressuring me that he wants to say something. I think he said just 3 sentences. I will give him that before I call on Professor Stanley Catherine to conclude. Thank you.
Thank you. The protocol is already established, but I must recognize my two presidents, the immediate past president and our own president, my own daughter, who is the chairman of the Pharmacy Council of Nigeria, Ma Hajia Wasilat Giwa. I recognize every other dignitary on the high table and every distinguished guest here. I stand here wearing two caps. Though they didn't give me a cap, I would have worn it. And I speak on behalf of pharmacists Nena Lan, Scholastica Lan, who is the national chairman of Association of Lady Pharmacists. When we talk about boarding, malaria boarding, we know those that are suffering from it. The vulnerable group are usually women, pregnant women, and even children under 5. I want to, as lady pharmacists, commend this great laudable initiative and to give our own support that we are definitely going to be part of this run. Like our chairman said, I remember when during the advocate of checking NAFDAC number, my little baby of about 5, whatever you buy, you say, have you checked the NAFDAC number? So using children, school children is like creating awareness. And then, will I say, public health now attending towards preventive. And this initiative is actually commendable. We want to thank you. Thank you all.
Thank you, Pharmacist Falamatu. Please, we're calling on Professor Ahmed Allah. He is Honorary Commissioner for Basic and Secondary Education, Sokoto State. He said he has just 3 sentences. So you help me in counting those 3 sentences. Once he said the first, the second, we'll take the mic from him. Thank you, sir.
Thank you very much. Let me start by recognizing my teacher and my former Vice Chancellor, Professor Tijani Bande, who is here present. I also like to recognize the organizers of this important event and all those who are here, commissioners, other important dignitaries. Thank you very much for giving me this opportunity. I've been the Commissioner for Basic and Secondary Education. I feel it is very necessary and important for me to be here. Why I just wanted to say 1 or 2 things is, each time I go out for supervision of my schools, both primary and secondary schools, I always find students, beaten by malaria, particularly girls. Yes, particularly girls. Most of the schools I went to, you find girls lying down, 5, 3, 4, 5 of them. I was even asking some health personnel, what is really the problem? Is it that in terms of genetic makeup, they are more vulnerable? So we started discussion on that. Now, why I feel it is important for me to talk is because of the fact that when I look at the caption, junior secondary and senior secondary schools, of course in my state, they are all under my ministry. But then I'm just wondering, what about the primary school children? Why is that they are not captured here? Because 1, they are the majority. If you take the total number of students in every state, I think primary school children constitute about 70%. So I feel if we can organize this competition in our primary schools, it will create a lot of competition. And in the primary schools, there are children, many of them don't even know what is malaria. When they fall sick, particularly when they are in the school, they may not even think of going to the hospital. So I think it is important for us to expand this and see how we can also include primary school. Then another thing is that I was reading in the newspapers, and I saw that Brazil has introduced a scientific approach towards controlling malaria by introducing what they call male sterility, inducing male sterility, preventing females from producing eggs, and thereby,
getting to have fertilization. So I don't know if this organization can begin to think along that line, trying to make sure that the female mosquitoes do not produce eggs by inducing male sterility. I think if we can do that, that is a very important approach too. Thank you very much.
Thank you so much, Professor Allah. What you just said, I think, let me give you a brief on that. My chairman, the CEO can also give response, but on the sterility issue of malaria, I think in a conference where I just attended recently in Malaysia, when we talk about ethical issues on climate change and health, that was brought up, and we can talk about sterility of malaria, but we're also looking at the ecological implications too, the environmental implications of removing that particular aspect in the life cycle of the ecosystem. So there are also devastating ethical issues involved in that. I think I should end it here. Let's also welcome Professor Stanley Catherine. She is the national chairman of Nigerian Association of Academic Pharmacists, and NAPA. She's here. And I think the members of the high table are ready, because after her speech, we're going to unveil this. Yes, no. I don't know what's wrapped there, but I know it's something good. And we're going to unveil it today. Thank you. You were meant to give a response to what he said. You know, he asked a question. Are you going to answer it after? Involvement of primary school education. Should I leave it standing, or you want to respond now?
Thank you very much. You have two questions, I think, involvement of primary school, and I will not take much of your time, rather than to encourage you and make a promise that a journey of 1,000 miles starts with a step. I think it is a belief that we are just taking the bold step. It is deliberate that we channel this to our youth. And I hope, believing God, that we continue to improve, and probably maybe by our next outing, we will think about incorporating the primary school as part of it. God helping us. On the second aspect, I think it's academic. I have to plead the intervention of Professor Yusufu to help us in that direction.
I think briefly she had, it's for research purpose, fine. But again, you have to balance the ecosystem. By eliminating something, you create another problem. But I think it's something that we need to look holistically, even with the public health people, and see exactly what we can do to able to ameliorate that.
Thank you. Director of Public Health. Yes.
Thank you so much. I'm talking now as Dr. Ntadom, not as minister. Please note. Thank you. Yes, I think sometimes we begin to look too high. Countries that eliminated malaria in the past, in fact, I said Belgium, 1912, there was no medicine. The common medicine we are used to, chloroquine, came into being in 1934. The UK eliminated in 1922. What did they do differently? We don't need to begin to think too high. The basic thing, environmental management. When your drainages and everything, if the mosquito does not have a place to breed, the malaria won't be there. So I think we should just focus. With all respect, due respect to our honorable commissioners, these are the lines we are thinking of now. Go to the environment, community, educate them, and these are what these children are going to do. Once they understand those basic things within the society, we will eliminate malaria. Thank you.
Yes, I see a round of applause to the members of this high table. You see, we have seasoned academicians on this high table. So I think, my commissioner, you are okay with that answer? Thank you. Professor Kachu Stanley, briefly, before we invite them to unveil.
Thank you. Good morning, everyone. Please permit me to stand on already established protocol. But nevertheless, let me also recognize my president of the Pharmaceutical Society of Nigeria and my immediate past president, Alhaji Tanko Ayuba and Professor Cyril Odianose Osifo, both of whom are on the high table. And even the chairlady herself of this occasion, who is also a pharmacist, a fellow of Pharmaceutical Society of Nigeria, and all other dignitaries on the high table. And the chairman, MD CEO of Geneith Pharmaceuticals. I greet all of you. And the rep of the Minister of Health, I greet all of you. Thank you for being here at this important occasion. Having said that, I am the national chairperson of the Nigeria Association of Pharmacists in Academia. And part of our core mandate is to educate, train the future pharmacists of tomorrow, and as well as conduct research into various issues of public health importance, top of which is malaria, the malaria scourge. And so you will agree with me that our core mandate aligns with the vision of Geneith Pharmaceuticals to combat the malaria scourge, to fight it to a standstill, and if not possible, to reduce it to the barest minimum. That is why we are here this morning represented. I stand on behalf of all the pharmacists in academia, nationwide and in the diaspora, to say we appreciate Geneith Pharmaceuticals Limited. Sir, you're doing a good job. And our prayer is that God will strengthen you and give you the grace and the provision to carry this vision, this noble vision, to a conclusive end. That at the end of the day, we say bye-bye to malaria. And like the Minister of Health said, part of what we also need to do lies with the government. All the ministers, all the commissioners, all the governors, if we can keep a clean environment, malaria will be almost all a thing of the past. There's no malaria in parts of Canada, America, UK. Why? Because of the environment. So if you see malaria abroad, they're imported by people from Africa, particularly West Africa. So please, let's not export malaria. Let's combat malaria and cause it to come to a standstill. Thank you very much for this wonderful project. I pray that going forward, our members stand ready to work with you, to collaborate with you, either as assessors or researchers, to bring this problem to a conclusive end. Thank you very much. God bless you.
Thank you, my national chairman, Professor Stanley. Catherine, next, we're going to unveil this. And I also have, I think they are sharing some meal tickets, with refreshments for after this unveiling. Chairman, are we ready? Members of the high table, we are calling on Hajia Wosilat Giwa. She is the chairman of the Council Board, Pharmacy Council of Nigeria. We're calling on our presidents, Pharmacist Ayuba Tanko Ibrahim. We're also calling on Professor Cyril Odianose Osifo. We're calling on Dr. Godwin Tandong. We're also calling on the CEO, Mr. Emmanuel Umenwa. And also we're also calling finally on Professor T.J. Bande to come forward for this unveiling. If they are all ready, you let us know. I also want to invite directors, our directors from Geneith, to also join this crew. Okay? Please, where is our commissioners for education and health? Please join them.
For me is better. Okay, thank you, my dear. Yes. Yeah, we are ready. Hello, everyone. You know one thing I want you to do for me? Let's give 3 big bozas to the CEO of Geneith Pharmaceutical. 1 boza first. Boza. I can't hear you. What about other people over there? Boza. Another one? Boza. And a big one? Boza. Yeah, I'm saying this, just like I said in my speech. This is a very bold and strategic initiative. Yeah, we've been looking for a way of rolling back malaria. This is a very brilliant step we are taking today. And I can assure you it's already a big challenge to other pharmaceutical companies. Because, you know, in public health, we need this kind of interventions. Am I correct?
You are right.
Yeah. It's not just, you know, about say, oh, the government will do it. The government will do it. All of us, we are government. And if we have opportunity, especially in pharmaceutical industries, we produce drugs for, you know, eradicating malaria. And, you know, Geneith, you know, MD is not even afraid that if we eradicate malaria, we won't be able to sell malaria again. But do you know there are other emerging diseases? And then we will have, you know, more opportunities to make more money and solve problems. So this is why, you know, I am aligning greatly with this initiative. And I want so many other pharmaceutical companies to think alike and pick on other areas of interventions to support our health system in Nigeria. And I'm proud, because I'm a pharmacist, that a pharmaceutical company is doing this for us today. And again, the target group is right. It's strategic. And they can do it. Because we've tried, you know, some initiatives on HIV/AIDS before using the youths, you know, in secondary schools and tertiary institutions. Like I said, they don't keep quiet. They keep moving with the message. Are you there?
Yes.
You keep what?
Moving with the message.
Please keep moving with the message. And I want you, you know, to tell the world that this initiative that is taken here, you know, must be something, you know, that should be replicated in so many, you know, West African countries where we have great burden of malaria. So, I don't want to waste your time. This is the right moment. We want to unveil the very big, brilliant, and bold project we are talking about. Can you all join me as we unveil this to the glory of Almighty God, and to have His blessing on this, and for this project to be very successful?